Welcome to the Friends of NPACE Podcast. My name is Josh Plotkin. I'm the Chief Operating Officer for NPACE. I'm thrilled to be in person with Dr. Lee Jacobs. We're recording this episode at our NPACE Hilton Head conference. Dr. Jacobs has graciously joined us before he kicks off his first session of the day in just a little bit. So many thanks, Dr. Jacobs, for joining us today.
Great to be here.
We're going to have a fantastic conversation discussing populations in healthcare who are underinsured and underserved. I know that's a specialty area of yours, and looking forward to our conversation.
Good. Very good.
Excellent.
Looking forward to it also.
So what we're going to do is get started, and I think this podcast is for nurse practitioners, but it's for general public as well, to get some information on healthcare and for them to get a better understanding of, sort of, for lack of a better way of putting it, how the system works, right? And so I think with that being said, what we'd love to touch on first is, how does insurance work in healthcare? I think people come into their doctor's office, they ask them for their insurance card, they plug in some numbers and are like, what happens from here? So can you give us the down and dirty, if you will, on insurance and how it works?
Well, first of all, that is a wonderful question, because that's just not asked that often. Very wonderful question, because it's very dependent on, yes, getting coverage, but then once you have insurance coverage, it still doesn't guarantee you get health care. Okay, you have access to health care. That's important, because a lot of people don't, especially where we live in Atlanta, there's not a lot of general transportation, public transportation. So you can have coverage and not be able to get to the doctor's office. So there's a lot of issues. And sometimes we say, oh, look, now we've got so many more people with insurance. Well, we need to be careful that we're talking about insurance that's accessible and affordable. Some of the new co-pays with some of the insurance policies are outrageous for our patients. So that's why we see them in our free and low income clinic, because they can't afford the copay.
Right.
So the label of being covered by insurance sounds really good, but we need to keep working as society to make sure it's accessible and people can really afford the care. That's so important.
And so with that being said, what have you seen recently for folks that are having trouble with getting coverage? Because many people are covered through their employer and programs there, but certainly states have programs as well. But folks who might be struggling to obtain insurance, what is the best thing that they can do to help themselves out?
Right. Very good question. Well, first of all, I think people don't talk enough about the ramifications of COVID. The number of people that lost their jobs, the restaurants, the movie theaters that closed down, our schedules in our free clinic doubled overnight because people lost their coverage, lost their insurance because they lost their job. So sometimes, and I kind of fault medical society a little bit, that we tended to focus so much on the debate of mask and vaccine, but we didn't think about, okay, who's taking care of the uninsured? Who's going to take care of these people who lost their jobs? And that's where the doors open for these free clinics.
Excellent. And so have you seen an influx or sort of an increase in those free clinics in your area or across the country? What's that been like over the past few years?
And it's interesting, because if you look around the country, and the best website for the viewers and nurse practitioners to look at is the National Association of Free Clinics. It's nafcclinics.org. That's a wonderful website. You can put in your area code and see what clinic is in your area, because that's where I really encourage nurse practitioners to look at what's available in the community. Again, we get a little misled when we say, oh, a lot of people have insurance. Well, when we get out there, people in your community may not be able to get that insurance, or if they do, they can't get care, as I mentioned. So that website is a really good way to find out what's out there.
I think that's a huge takeaway for the audience. Can we repeat that one more time, what that website is?
Yes, it's the National Association of Free Clinics, nafcclinics.org. And again, they've been wonderful from the beginning. They've always helped us, and they organize national meetings and communication, and they work with legislation. So it's just been a good organization to deal with. But for nurse practitioners who want to get engaged, that's a really good website to find what's in their area.
Awesome. That's a great resource, and certainly encourage the audience to check that out and get more information, especially if you're dealing with patients where that might be helpful. Right. We're going to pivot our conversation a little bit in terms of another area that you focus on, which is the underinsured in areas of the country that have difficulty when it comes to insurance. Can you talk a little bit about some areas of the country where you see things that are very disproportionate? Is it rural areas? Is it urban areas? Or is it areas that we're not even thinking of that are having these issues?
Very good. Good question. These are a lot of good questions.
We try.
And actually, it's all the above, because the rural and the urban are all having issues. We have, for example, we developed a mobile unit. Our director did 2 or 3 years ago. And so we aren't just in a brick building. We have to be out where the people need the care. And so we go to the homeless areas, the tent cities, to care for those who just have no care otherwise. But as I mentioned earlier, people can have insurance and not be able to access it. So we really have to be available for them. So what we do at Bethesda, by the way, this clinic, Bethesda clinic, primary care clinic, was started by a nurse practitioner about 13 years ago. I've been with them as a volunteer director for 13 years, 12 years. And I'll tell you, it meets a major need in the community. And we provide quality care, and patients know that. Okay, they don't mind coming and waiting for 2 hours if we're real busy. Okay, they get inpatient other places, but not with us. And so it's just really quality medical, and that's so important. Quality care. People have basically 7 days a week they can communicate with us. That's important. So yeah, all around the country there's these gaps, and I think again it's more than just a label. I got insurance. I don't have insurance. The question is, can I afford it? Can I come in? A lot of the homeless, a lot of the people who are having issues around the mental health, which is probably the biggest issue in the communities, is mental health care, the depression, the anxiety, the drug abuse. All of those we see every day, and it's very difficult, very difficult. So we rely on volunteers. We rely on volunteer nurse practitioners, and that's true around the country.
Excellent. So I think there are a few takeaways from what you just said, and we'll start sort of where you just ended that. So nurse practitioners as volunteers is a huge help to the community. Where are some of those places that nurse practitioners who may have interest in volunteering, where can they go? How can they get involved?
Right. Good question. So bottom line is you could use that website to find out what's in your area, what free clinic is in here, what is available, and then go visit. Just kind of drop in and visit, meet the people. You can shadow, just hang around, because they're if I was to label our practices, and this is true around the country, it is a complicated primary care. So yes, it's primary care, but it's a very complicated primary care. I still work with an organization, a large organization, which is much more organized and not quite as complicated as ours. So they need to come, and I encourage them to come and shadow, to be involved. And what we've seen over the years, and people get involved, including nurse practitioner students.
Yep.
It's a powerful experience for them, where they can see real healthcare, where money's off the table. It's not about money, it's about their healthcare. And we've seen people come as, oh, I'm going to go specialize, I'm going to be a surgical nurse practitioner. Then they come and spend time with us, say, you know what, I want to go in primary care, I want to take care of the total person. So it's been a great experience for nurse practitioners. We rely on community collaboration. We rely on the hospitals with good contracts for those who have no insurance, no money. We rely on the free dental care that we can get, oral dental care, all of those available through communities, and that's all about collaboration. And in my experience, nurse practitioners do a great job from compassion and truly working with collaboration and community. So we've really appreciated that.
I think nurse practitioners specifically are very interested in making an impact, I think. And so it sounds like, if there's an opportunity for you to be able to get involved in this arena, it's one that you should definitely check out. I think, as you mentioned, somebody who might have the mindset of going into a surgical nurse practitioner role comes into this community role and sees that what they're doing in the real world impact. Perhaps they see a patient who is in a difficult situation who improved, and
Absolutely.
that gets them on to the next
Absolutely.
one.
And you can get your family engaged. We've seen spouses, we've seen children, high school children come in because their mom's there, father's there, and then they get involved with this kind of volunteerism, and it's a healthy thing for the family.
Excellent. In terms of, and you mentioned some members of the healthcare team that also get involved, that sort of collaboration between not just primary care, but the dentist office, counselors, perhaps, if there's substance abuse and things going on.
Right.
How what has your experience been like in terms of working with folks that are part of not just nurse practitioners in primary care, but different specialties, different professions even?
Oh, yes. And basically, when you say collaboration, what probably was best, I think the best example was with the Ukraine refugees. We had a special day with a mobile unit to care for people from the Ukraine that were just displaced quickly. Um, and it was kind of neat in that the loving care that our nurse practitioners and people gave was wonderful. And then the community stepped forward that we would go and work for the dentists, the oral surgeons, the obstetricians, the hospital that would provide the free care. We had 3 babies delivered in the first month. Okay, all of it free. And I'll tell you, it really was touching for the Ukraine refugees to see the whole community stepping forward. I had a lady that went to an oral surgeon, and I called the translator after to say, hey, how'd the visit go? And she said, well, she's crying right now. And I said, oh, well, I guess it wasn't a very good visit. Oh, no, no, no. It was incredible.
Happy tears.
Absolutely. So grateful for free care. I mean, I've had people come back to my office, Ukrainians, saying, where can I pay? Aren't I supposed to pay? And to know it's compassion for them is just so neat. And yeah, a community collaboration for sure.
Community collaboration, compassion.
Yep. Triple C's.
Triple C's.
Get the coffee cup out. That looks great. That looks good.
Excellent. So I want to talk about something that actually came up in a session yesterday, and it somewhat crosses over with insurance, but it's the cost of some of the drugs that are out there right now, even if they're covered through your insurance. I was talking with another speaker of ours, Dr. Baldridge, and she had mentioned that even when you are covered, depending on some of the pharmacies that you might be working with,
Yep.
that because they don't have the supply, or they can't compete against some of the larger pharmacies that
Right.
they have a patient that's going to get a drug that they need
Right.
at a super high cost. Do you have any tips, anything,
Right.
suggestions about how patients and providers
Right.
can try and mitigate those situations?
Yes, and you have a lot of good questions today.
I came prepared.
great.
Well, I had my cup of coffee.
There you
before
go.
we started.
Good question. No, the whole issue around the cost of medicine, first of all, it starts with the ordering nurse practitioner, physician. It starts with us, okay? Because so often we can be ordering an expensive medicine. We could be ordering Augmentin for dental care when we know that good old-fashioned amoxicillin is just as good by many studies. So it starts with the ordering person for sure. Then, yeah, if there's real expensive medicines, I know some of these new weight loss medicines are very expensive. Then if you have no insurance, you can apply to the drug company. We do that. In our office, we have a person, that's her job, to go ahead and apply for coverage, whether it's the ADHD, Adderalls, or what have you. Anything expensive, we would apply directly to drug companies. If the person qualifies financially, they would get the free coverage. The in-between then, where I don't have that kind of need, I'm working, I have some income, and the doctor ordered this medicine, it's pretty expensive, then I would say definitely shop around, because number one question, is there a generic?
Right.
And then number two is definitely, I use goodrx.com to just search the local pharmacies to find out where the best cost is. And that is a wonderful site to do that.
Have you, you just mentioned GoodRx, and Mark Cuban has
Yes.
come out with cost plus drugs. Have you heard of that? Do you
Yes, I
know
have.
any more about that in that situation?
I don't know that much about it at all. I know that they've made things available, medicines available, which is really good. But no, right now we pretty much have just used the companies. And then we actually, through Blessings International and AmeriCares, are nonprofit organizations that donate medicine to us. Okay. So we have a lot of medicines available. Pretty much the commonly used antibiotics, the commonly used medicine for diabetes, et cetera. So we get a lot of those free for our patients.
Okay.
And that's so helpful.
And would
That's
you
so helpful.
recommend providers reach out to those resources if they're in a similar situation and could benefit from those donations?
Absolutely right. Absolutely. And again, that's where maybe the local primary care clinic, the local free clinic could help.
Right.
Saying what's available in the area, what they could do. Yes.
I think how I want to sort of take our conversation next is more the patient side of things. And I think that patients, we kicked off the conversation sort of saying, you have insurance, you come in, you give them their card, bing, bang, boom, you have your medicine at some sort of cost. But what can patients do to better educate themselves about how insurance works and what can patients do to help themselves obtain insurance if they perhaps don't have it and resources that are available for them.
Very good. And they do need help to do that. The majority of people would need help to do that. And that's why our office is set up, for example, to be able to help people apply for free care at the hospital or help people apply for insurances, the Medicaids and the Medicare, because it's difficult. It's complicated for a lot of people. And a lot of our patients, even though they may have a place to live and they may even have a job, that's a big hassle for them. A lot of them are internet savvy. So it's some real challenges trying to get that information out to them. I think it's responsibility of the healthcare system. I think it's responsibility of the doctor, nurse practitioner team, and others to say, here's how you do it. Because a lot of lot of trouble getting educated. Then you take it where they're at. It's hard to go and teach some of our patients about a good diabetic diet when we know they're having trouble finding food at all. Okay. And these are people who can be working and can be having a place to live and they still have financial trouble. They can't even find food. So it's got to be on a case by case basis about what kind of insurance you can get. Here's how you can do it. Here's the foods that are available in the community, the pantries, etc. So it takes a team. It really does.
I think that's one of the biggest takeaways is that, primary care clinics are so busy and, you have these 15 or 30-minute windows of opportunity to meet with each of your patients. And, you got a patient out in the waiting room. I got to wait a little bit longer than I want to.
That's right.
But I think what you just said really hits home. If you spend that extra 5 or 10 minutes with the patient that needs that education to help themselves in a situation like this, perhaps you're going to save yourselves hours of time down the road.
Absolutely right. Absolutely. And it's all part of the care experience for sure. A big part of it. We talk about educating people. We got to know where they're at. We got to know where they're at financially and all the other issues we've talked about before we can do a good job in terms of good patient education. That's right.
Absolutely. Is there anything else that you think patients or providers should know when it comes to insurance, underserved populations? Any parting thoughts or final words that you think folks should know?
Right. I think, and it is a matter of knowing who you contact. I've had a lot of people, whether it's the Medicare, Medicaids, or other insurances, and have no idea. It's like I have a card, I got some numbers on it, and I have no idea who to talk to. I think that contact channel is so important, and a lot of people just don't do that.
Right.
So that's going to be important.
Do you recommend folks, calling their insurance company and the numbers on those cards? Did the insurance companies themselves have resources for patients where they can learn a little bit more about how things work?
Oh, the insurance companies, I know they definitely do. Those customer service numbers in those cards are invaluable. If they have trouble, we call it with them. Okay, we can sit in the same room with them and call. But yeah, the extent of coverage and what have you. Even who can I see as a physician? Who can I see as a nurse practitioner? Where do I go? Those kind of questions are so clear if people could just call.
Yeah.
But again, a lot of patients don't have that capability. We have many of our patients don't have cell phones.
Yeah.
So you got to do what you got to do. But that's what you said earlier. It's taking the time in the exam room that the nurse practitioner, physician can say, okay, let's find out what's going on here.
Right. And I think one other thing that comes to mind is for providers, and I think this has changed drastically since COVID as well, is the pharmaceutical companies and the reps, the liaisons that they have. The office visits don't happen as much as I think as they used to.
Right.
But these folks still exist. They're still there.
Right.
I think that those folks are a resource to the providers. I think one of the most common questions that we get for every session, especially the sponsored ones that we have, is, can you talk about insurance and coverage for this specific product? So I think that that's a resource as well that should be tapped into.
And I think when you start having this kind of conversation, I think the patient, a lot of times we want to make sure they know we're here. We don't take insurance. We want to know we're here because a lot of time people just sit home then. Or they go to the emergency room. That's why the hospitals for their readmission problems and the emergency rooms are very good friends of ours because they see us as filling a major role, whether you get insurance or not. If you don't know how to use it, come and see us. We'll take care of you. That's so important. Again, it's more the compassion than the insurance part.
Excellent. I think the biggest takeaway is if you feel that you need more information, tap into the resources that are available to you, no matter what seat that you may be sitting in.
Perfect. Good summary.
Excellent. So, Dr. Jacobs, can't thank you enough for taking time today. He's got to scoot to his session. We got a great session on insurance coming up here in Hilton Head. Thank you so much for taking the time.
My
and coming
pleasure.
down
And thank you
early.
for having me. I appreciate it very much. And NPAC, by the way, does a great job. I mean, I've been at conferences before, and your organization at these conferences, I mean, just are top notch.
We
So I
appreciate
invite
that.
nurse practitioners to step forward and get involved here. Thank you very much.
Thank you. So a few final words here for our audience. Be sure to check out the Friends of NPACE podcast on your favorite streaming platform. We're on all of them: Apple, Spotify, Amazon, so on and so forth. We are an ANCC accredited provider providing continuing education at in-person conferences, as Dr. Jacobs just mentioned. We have over 200 courses available in our online learning center as well at learn.npace.org. So check that out. See if there's anything that you may need to help fulfill your CE needs. Some free education and resources there as well. And we want to thank our audience for tuning in. This has been a fantastic conversation, one that I think needed to be had. And we invite everybody to join us on our next episode that will be out so soon. Stay tuned to NPACE social media channels where we have updates in real time about all different things going on in NPACE. Dr. Jacobs, thanks so much.
Very good to be here. Thank you.
All right, take care, everybody. We'll see you on the next episode.